Bismillah ar-Rahman ar-Rahim. This lecture will be about fertility awareness. What is fertility awareness? Fertility awareness is a concept that provides basic information about fertility and reproduction, signs and symptoms of fertility during fertility cycle or fertile cycle. Why? It is important for these reasons. Making decision about family planning, especially natural family planning. Natural family planning is a very common method around the world for those who wish not to use contraceptives, whether they are medication, pills, devices, chemicals, whatever. It's also good for planning or avoiding pregnancy, enabling women to value their fertility, and it will save women from infections and sexually transmitted infections. So, natural family planning is identifying the fertile and infertile phases of a woman's menstrual cycle by observing the signs and symptoms of fertility to plan for pregnancy. As we said, planning for pregnancy when a woman and the man knowing these signs and symptoms of fertility during the woman's cycle, it will maximize the chance for conception and thus timing the intercourse in fertile days of the cycle. At the same time, avoid pregnancy, abstaining from intercourse in these fertile days of menstrual cycle without using any modern contraceptive methods. Is it effective? Yes. For couples who are motivated not to use any kind of contraceptives, modern contraceptives, and taught well for such method, by experienced teachers, efficacy is up to 98%. Advantages of natural family planning: no drugs, no devices, suits the woman's normal physiology, no physical side effects, improve the communication about the sexuality and share responsibility about family planning, help conception, religiously, morally, and culturally acceptable around the world, even for Orthodox and for other religions that prohibit using the modern contraceptives. It fits all kind of ideologies. Cost effective, no need for medical supervision after adequate teaching. What are the disadvantages? Disadvantages: it takes time to learn fertility symptoms, requires initial teaching, high user failure rate, needs serious commitment of the couple. Scientific basis. Let's talk about the male physiology first. Facts on sperm. Sperm will survive for 3 to 7 days in a woman's cervix in the presence of fertile mucus. What is fertile mucus? That will make the sperm survive. It's alkaline mucus produced from the secreting cells lining the cervix. Sperm also will be destroyed within hours if remaining in the vaginal acidic environment in the absence of alkaline cervical mucus. During the infertile phase, sperm cannot penetrate the cervix due to the thick sticky mucus plug blocking the cervix. It's closed. Sperm might be contained in the lubricating fluid man releases prior to ejaculation, so it should be known. And now we will talk about female fertility cycle physiology. The menstrual cycle vary in length from 23 or less days in short cycles to over 35 days in long cycles, and the average is 28 days. So if we talk about the pre-ovulatory phase of the cycle, it begins in the first day of blood, controlled by FSH and estrogen. And estrogen levels rise approaching ovulation. The endometrium becomes thicker, the cervix becomes higher, softer, and open. Cervical mucus changes to a very sperm-friendly, increasing salts, sugar, and amino acids to nourish the sperm with high fluid, 98% water, with transparent, slippery, and stretchy appearance, and basal body temperature remains low. This phase ends with ovulation within 36 hours after surge of LH hormone, with variation in duration according to cycle length. The post-ovulatory phase, the interval between ovulation and the next menstrual period, remains reasonably constant, around 14 days. This is very important. This phase is controlled by progesterone released from corpus luteum. So changes influenced by progesterone include softening the endometrium for plantation, cervix become lower, firm and closed, cervical mucus becomes hostile, preventing sperm penetration, and temperature rises by 0.2 Celsius. So as you see, we are entering to these symptoms, these changes that we see or we know from the physiology. So let's see in these pictures: ovarian hormone, estrogen, progesterone, day 1 from day to day 28, ovarian activity as the variable length, constant length, pre-ovulatory comes to ends with ovulation, constant length, which is growth and degeneration of corpus luteum. This is post-ovulatory. This is important for the understanding of the natural family planning. These were the ovarian changes or activity, and the cervix and mucus. Menses, thick mucus, thinner changing, watery peak, thicker peak, thick mucus. Where the infertile comes the thick into the thick, which is infertile, but the fertile days will become thinner changing, watery peak. It is around 10 days, 9 days, and so on. The rest will be infertile. Basal body temperature also changes. There is a rule also we will see, 6/3 rule, or 3/6. Let's see the lower temperature pre-ovulatory and progesterone, higher temperature post-ovulatory. So the fertility cycle, as we see, period is blood with red. The green is fertile days. I'm sorry, infertile days is green because it says family planning, no pregnancy. Post-ovulatory, infertile days. The yellow, ovulation or fertile phase. So sperm survival with fertile mucus, ovum survival, and so on. So what are the indicators of fertility? Waking up temperature, cervical mucus changes in the cervix, calculation of cycle length, minor indicators. The most effective method that a woman can do or practice, combination between temperature and mucus symptoms, we call symptothermal method or calendar method. Temperature: recording the daily basal temperature at the bed with charting. We look at a shift in temperature, confirm ovulation, and sustained rise in temperature for 3 days indicates 48 hours post-ovulation. So the post-ovulatory phase begins in third day of high temperature. And in the pre-ovulatory phase, the temperature keeps low until the ovulation occurs. If we apply the rule 3/6, it means that we get a typical temperature chart, 6 days of low temperature before the temperature shift, and 3 days after the temperature rise. It says 3/6, 3 in the progesterone, 6 in the estrogen. So it indicates no pregnancy. Maintaining high temperature after the third day of high, it will indicate pregnancy. Cervical mucus change in menstrual period, blood period, is followed by some dry days, 3 days, which may be absent in short cycles and more in long cycles. Maybe in the short cycles, none. In long cycles, maybe 5 days. In normal cycle, 3 days and maybe 2 days. Recording mucus changes at the vaginal entrance on the chart include sensation and appearance. So sensation include dryness, infertility, moistness, potential fertility, and wetness. It indicates fertile days. So appearance of the fertile mucus also is transparent, slippery, and stretchy, similar to raw egg white, which is peak day of such mucus. When such mucus appears, it indicates ovulation. There should be no intercourse for those who wish not to get pregnant. After the peak day ends, dryness, infertile will appear and will last until the next period. So 14 days until the next period is safe, infertile days. So this is the as we said before, about the sensation and the appearance of the mucus: moist or sticky, wetter, slippery, and so on. This also about the combining the third temperature and mucus recording. So this is the period blood, dry day, but here we see seminal fluid, which indicates intercourse, moist. This, the yellow, indicates fertile days, so there should be no intercourse. The dry days, it should indicate no fertility. Dry days, so intercourse is allowed, and so on. Also combining the mucus with the temperature. Changes in the cervix: low, long, firm, closed, and dry cervix indicates infertility. So low, long, firm, closed, and dry. While high, short, soft, open indicate fertility. So we should know these symptoms. Calculation: we might use the calculation also based on the length of women's periods, 6 to 12 menstrual cycles. This is not always a good indication of the calculation. It needs a lot of training to do the calculation. So it might not work with those who are not motivated to do calculation. The length of the shortest and longest cycle are used to identify the likely fertile time. Shortest cycle minus 20 equals first day, fertile day. Shortest cycle minus 20, while longest cycle minus 10, last fertile day. In regular long cycles, 26 to 32 day cycle, standard day rule may be applied. First fertile day is day 8, and last fertile day is day 19. So it varies according to the cycle length. Minor changes also might appear. They include the abdominal pain, abdominal heaviness, breast tenderness, and back pain. These are the pictures of the before ovulation, at ovulation, and after ovulation, regarding the cervix, of course. So those who are planning for pregnancy, conception is possible at any fertile day, but most probably with fertile mucus present, which is within 2 days prior to peak day. So the aim is to avoid pregnancy. Couples should learn accurately identify the phases of fertility and fertility by observing and recording the indicators of fertility. So some factors may disturb the cycle and affect the recordings. These include stress, travel, illness, medication, late night, and some other conditions. Let's look at this graph, changes of conception study of Professor John Marshall, John Barrett. It indicates days relative to temperature rise, before temperature rise, and after temperature rise. So, probability of conception on any day. Probability of conception on any day. Temperature rise. As we see, the most likely days relative to temperature rise is 30%. This is the conception. 17% conception. 20% 4 days before ovulation. And 1 day before ovulation, 14%. And 1 day after ovulation, 7% only. So most probably 2 days before ovulation, conception will occur at 30%. This is combination of all of the things. The sustained high temperature indicating pregnancy, and as we see, the period, the day of cycle, period of, and mucus, and so on, all indicators. This is also a real life with all symptothermal chart showing correlation between all indicators of fertility. For example, breast tenderness, feeling of heaviness. Everything is recorded. Cervix, rising, opening, softening, tilt, heavy, mucus sensation, period of blood loss, dry days, mucus, highly fertile. So these charts will help those couples who are really motivated. Thank you.